All right, so let's talk about Class 2 amalgam restorations. So we've all talked about the matrix now. You know the reason for that. Make sure it is the correct matrix selected and that it is on the tooth in the correct way. It is placed snug around the gingival area of the tooth. Your wedge is in place and you have burnished your contact point. So when you've gotten that far, the next step is to actually start filling. All right, so your first increment of amalgam should be placed at the gingival extent of your box. Condensing action should be followed in a gingival and lateral direction. So make sure you're really getting it into all those little areas. Now, the one thing you want to be careful of here when you are condensing against the band, it's a tricky one. You want to use enough force where you have adequate condensation, but not so much as to extrude it outside of the band. I mean, the band is in place tight, but it can be overcome by your force if you're pushing hard enough. And of course, when you're always working on a mandibular tooth and you're condensing, make sure you support your patient's jaw. You do not want it bouncing around. So continue adding amalgam in the same method as you did into the interproximal box first. Build that up to the level of the pulpal floor, and then you continue as you would in a Class 1 restoration. So once you have the entire preparation overfilled, okay, very important, you want to overfill, and you've likely done a pre or pre-carve burnish. You want to make sure that you clean up any excess amalgam that is around the area of the matrix band. And the easiest way to do this is to use your Explorer and run it around the entire band, and you're going to loosen up a lot of excess amalgam that might have collected there. So you want to do a quick carve before you even think of removing your band. Remove any gross amounts of amalgam from around the band area and shape your marginal ridge a bit. Okay, you don't want it so high where there's a lot of excess that is unsupported by tooth, because that will break very easily when you go to remove the band. So as we've mentioned before, you want to use extreme care when removing that band. Once you get the band off, you're going to then have to move very quickly because now you have to clean up any excess amalgam that is around all your margins, put some anatomy in there, and check occlusion. After everything is said and done, you want to run some floss through your contact points to do one of two things. Ensure that you have a contact point, and then secondly, to make sure that you can actually pass floss through it so your patient can floss and keep that area clean. Things change slightly when we're looking at a Class 2 restoration with composite resin. So your matrix band application is the same as it would be with amalgam, and you of course want to make sure that you have adequate wedging and that you have adequate pulpal protection. You want to place your etch as you would for any other resin restoration, 20 seconds, phosphoric acid etch. Then you're going to use your bond, follow manufacturer's instructions, 1 to 2 coatings for the bond that we use at school, 3 to 5 for others, and of course air dry your bond always and cure. Now this is the important part. When it comes to placing composite in the box of your preparation, that's an area that can be put under quite a bit of strain when the resin undergoes polymerization shrinkage. And in order to prevent that, we place a small amount of flowable resin in the depth of that box. Okay, so you want to place a small amount of resin, and over that you want to place an increment, a very small increment of your normal composite, okay, on top of that flowable, and then cure for 20 seconds. So the placement of that flowable resin underneath that initial increment will act as a stress reliever. Okay, that flowable resin has a little different modulus of elasticity and can flex a bit more. And so that's going to provide some stress relief to your composite resin in the box. And then you want to continue to fill your restoration with layers that are no greater than 2 millimeters, and obviously curing between each layer. And remember, when it comes to resins, the farther your light source is away from your increment, the smaller your increment should be. So if you have a very deep box, you likely want to stick to 1 millimeter or so bulk of resin increments. And then finally, you want to finish your composite resin using composite burrs and enhance points. You likely won't be able to use discs. And the hard part with this is if you in fact have any overhangs that are occurring in the gingival area, removing these can be very, very difficult. Hand instruments really don't work well, although you can sometimes plane the area a bit, but you have to use finishing strips and burrs to clean that. So the lesson here is to make sure you have an ounce of prevention and you have really, really taken the time for that matrix to be placed well and the wedge to be placed well. And that will help prevent some of that extrusion into the gingival cavus surface margin area.